Hey guys, welcome to my YouTube channel. It's Nurse Lally's here and I'm back with another video. Before we go any further with this video, guys, I am going to have to apologize because I'm in the dark and we're having load shedding, but I thought to myself, oh, you know what? It would be really sad if this day goes to waste and I don't record a video. So I just decided, you know what, let me just record this video because I am feeling a bit inspired. So yeah, anyways. Hi guys, welcome to my YouTube channel. It's Nurse Lally's and I'm back with another video. Today I'm doing another educational video and I will be talking about bleeding during pregnancy. So if you are new to my channel, thank you so much for sticking on this video, and I hope you're going to like what you hear from this video to the point that you realize that you need to subscribe. And if you are a returning subscriber, thank you so much for coming back. I really appreciate you guys, and I hope I am still continuing to give you good content that will make you stay and come back and come back and come back. So yeah, today we are talking about bleeding in pregnancy, and this is something that's important and that I realize I need to talk about because bleeding in pregnancy is one of the danger signs in pregnancy. So the 5 danger signs in pregnancy are bleeding from the vagina, water coming out of the vagina, low abdominal cramps that are severe, decreasing fetal movements, and severe headaches. So the one that we're going to talk about today is the bleeding. Why is it so important to know the dangers of bleeding in pregnancy? What are some of the things that cause bleeding in pregnancy? And what are some of the things that you can do to try and prevent some of the things that you can actually prevent? Because one thing about health, guys, there are certain things that we can prevent and there are other things that we just cannot do anything about. So what I like to say is the things that we can actually prevent, how do we prevent them, or what are the steps that we can take to try and avoid those things or prevent them from happening? So yeah guys, without wasting any time, let's get on to this video. If you do enjoy this video, please do give it a thumbs up. Please subscribe to my channel and click on the notification bell so that you are always notified when I post a video. And if this video interests you, please do not hesitate to leave a comment and share this video with other people that you think might benefit from it. So let's get right into the video. So when it comes to bleeding in pregnancy, we can divide it into early pregnancy related bleeding and late pregnancy related bleeding. So let's talk about early pregnancy, which is usually like the first trimester and the second trimester of your pregnancy. So one of the first things that can cause you to have some bleeding or some spotting in early pregnancy is implantation. So very early on, when an embryo implants itself into a uterus, you might have an implantation bleed. So that happens around about 2 weeks after conception and round about during the time that you would expect to have your period, right? So the menstrual cycle is about 28 to 30 days, right? Depending on who you are, it varies for every woman. Around day 14 of the menstrual cycle, you will have ovulation. And that's also around that time where you are more at risk of falling pregnant. If you do fall pregnant, the embryo will implant itself inside your uterus in about 2 weeks from ovulation and around about the time that you're supposed to have your next period, then you will see that bleed. So implantation bleeds, they're not supposed to be heavy bleeds because an implantation bleed is different from your period. It should be lighter, but actually some other people, they don't realize that they're having an implantation bleed and they might mistaken that implantation bleed for a period. Most people don't know by that time that they are pregnant. But usually implantation bleeds, they are not harmless. They don't cause any pregnancy complications. It's literally a normal process of the embryo that is developing, implanting itself in the uterus so that it can grow into a pregnancy. And then another thing that can cause you to have some bleeding or spotting in early pregnancy is changes to the cervix. So there are hormones that are maintaining your pregnancy, and those hormones can act on your cervix to maybe cause some inflammation on it, or just cause your cervix to become more sensitive. Or you might be having some inflammation in your cervix because of a vaginal infection in the case of STIs or any other infections that might affect your cervix, but it's usually like your sexually transmitted infections. So it can be an infection, it can be inflammation in the cervix, or it can be growths that are on your cervix, like polyps, or like any growths that just get irritated, like when you have sex, then those growths, they just become irritated and start to bleed. Or you have a vaginal infection and you have sex, and then you have that bleeding after sex. So it's usually things like that that have to do with the cervix, usually occurring after having sex. And then another thing that can cause bleeding in early pregnancy is a miscarriage. So with a miscarriage, the most common time to have miscarriages, or a lot of the miscarriages, they actually happen in the first trimester, which is the first 3 months of your pregnancy, and they're usually caused a lot by chromosomal abnormalities. So that would be abnormalities in the baby. Perhaps the baby was just not going to be able to survive, or the baby was going to have abnormalities. So as a protective mechanism, what the body does is that it expels that pregnancy. So sometimes with miscarriages, you might just have only the bleeding, or you might have bleeding that's associated with cramping in your lower abdomen, that's like period-like cramps. So yeah, that could be a miscarriage. And then you might be having some bleeding because you're having an ectopic pregnancy, which is a pregnancy that it doesn't implant itself inside the uterus. It implants itself maybe in the fallopian tubes. And as the pregnancy is getting bigger, it causes bleeding from the tubes, so you might be having spotting. And in fact, if that pregnancy progresses and it even ruptures, you might have like heavy bleeding, you might have the severe abdominal pain, and it can be very, very dangerous if it's not spotted on time. So those are some of the things that can cause bleeding in early pregnancy, for example, in the first 3 months of your pregnancy. So when it comes to the implantation bleed, it's completely normal. It doesn't have or shouldn't have any adverse effects on your pregnancy, and most people are not aware of it. And then when it comes to the cervical changes in terms of like the infections, if it's an infection that's causing the bleeding that you have in early pregnancy after sex, it's advised for you to ensure that you get tested for STIs and get treated with antibiotics and practice safe sex, meaning that you use condoms to protect yourself from sexually transmitted infections, and being faithful to your one partner, or sticking to one partner that is also faithful to you, so that there are no STIs or infections that are gotten from other people and brought into your relationship. So safe sexual practices are going to help you to avoid vaginal infections that can cause that bleeding in pregnancy. And then also, if you have any bleeding outside of pregnancy before you fall pregnant, get that bleeding sorted out, especially if it's not part of your menstrual period. Because if you have any growths that are in your cervix, it will be a good idea to have them treated so that they don't cause any problems while you are pregnant. And then when it comes to a miscarriage, mostly, especially with first trimester miscarriages, nothing can be done about them, especially if the miscarriage if the miscarriage is taking place because of chromosomal abnormalities that are in the baby, then not much can be done about that. But if you are having an ectopic pregnancy, one of the things that you need to do early on in your pregnancy that would help you to know whether you're having an ectopic pregnancy before you actually start bleeding is an abdominal scan. So if you find out that you are pregnant or you miss a period, it's a good idea to go do a scan or take a pregnancy test. But with an ectopic pregnancy, you will have a pregnancy test being positive, but you still need to do the scan to ensure that the pregnancy is in the right place. It's in the uterus and it's not in like the fallopian tubes or anything like that. So with an ectopic pregnancy, we also cannot do much to prevent it, especially once it's already there. But at least for us to be able to know beforehand what kind of pregnancy we have, you need to do a scan to know where your pregnancy is situated. And then another thing that can also happen in early pregnancy or between 10 and 20 weeks is maybe bleeding that is caused by a miscarriage that is caused by cervical incompetency. So sometimes when a person does a pap smear and they find abnormal results in the pap smear, results that are abnormal from the cervical cells, they might do cervical procedures on your cervix, and some of those surgical procedures, they might actually weaken your cervix. So if it's a pregnancy loss or a miscarriage that's maybe in the second trimester, it could be because of your cervix being weak, which we call cervical incompetency. So that's one of the things that can cause bleeding in early pregnancy, because of your cervix probably opening and you're starting to have a miscarriage in that way. So that's also something that's very important. If you've had abnormal cells in your cervix that had to be removed, and maybe you had to do a cone biopsy to check these cells that are abnormal from your pap smear, or maybe you had to do surgery to remove those cells, or you had to do any like procedure where they had to check the cells in your uterus. Maybe they had to open your womb through a procedure that's called dilatation and curettage. So some of those things that can weaken your cervix and might put you at risk for having a miscarriage that you would see through bleeding in the initial phase. So if you know you've had such procedures on your uterus or on your cervix, it's a good idea to talk to your gynae or your midwife about them. Because there are things that can put you at risk for bleeding or having a pregnancy loss, especially in the second trimester. And then another thing in early pregnancy, the second thing that I wanted to mention that can also cause bleeding is something that's called a subchorionic bleed. So the chorion membrane, it's the membrane on the outer part of the amniotic sac, which is the sac that carries your baby. So if there's a bleed between that membrane and the uterus wall, you might have some light spotting or vaginal bleeding. So some of these subchorionic bleeds or hematomas, they can resolve on their own, but whatever bleeding you have, whether it's light or if it's heavy, especially in the case of like a subchorionic hematoma, this one would be seen via an ultrasound scan. So if you see this kind of bleeding, it's a good idea to always speak to your healthcare provider, whether it's your gynae or your midwife, so that they can do the necessary investigations, whether they will do blood tests or whether they will do an ultrasound scan to see where the bleed is originating from. And then be able to give you advice. So some subchorionic hematomas, they do resolve on their own. Some might end in a miscarriage. So it's always better to always just let your healthcare provider know of what's happening. Whatever bleed you have, whether it's small or a lot, just let your healthcare provider know so that they can always be checked or at least monitored, and you can be on the safe side. Then later on in pregnancy, the kind of bleeds or the things that can cause bleeding in pregnancy, firstly, cervical changes as well. If later on in your pregnancy you are having vaginal infections, then you might have that bleeding from the cervix after sex as well. And then another thing that can cause bleeding in pregnancy later on now, especially after 24 weeks of pregnancy, it's things like placental abruptio. So placental abruptio, it's when the placenta, it detaches from the wall of the uterus. So now when that placenta detaches, obviously there's blood vessels on the placenta, and then those can cause there's blood vessels on the placenta and there's blood vessels on the uterus that are bringing blood to the placenta. So once there's that disconnection between your uterus and your placenta, you will have bleeding, right? And it's very dangerous because it can cause you to go into preterm labor. And now, because the blood is actually not flowing as it should and you're losing the blood, so the blood flow to your baby will be compromised. So that can compromise the health of the baby. So if that bleeding is not checked and you lose a lot of blood, you might actually end up losing your baby. It might result in an interuterine fetal death. So it's very, very important. And this bleeding in placental abruptio, it may be accompanied by your uterus becoming tense and rigid and hard, and then you're having the bleeding. You might have decreased fetal movements. So it's very, very serious, and this one might actually result in you having like heavy bleeding. So very, very important. You need the emergency room for this kind of bleeding. And then another thing that can cause bleeding later on in your pregnancy after 24 weeks is placenta previa. So placenta previa is when the placenta is either low lying or it's lying very close to your cervix or lying on top of your cervix, right? So there are different stages of placenta previa, and usually your gynae or your sonographer, they can be able to check where your placenta is located. And the issue comes when it's low lying or when it's over the cervix, then definitely you'll be having bleeding. But sometimes it can be low lying, and they might throughout the pregnancy monitor the movement of the placenta and see if maybe later on in your pregnancy it doesn't move away from the cervix. But this one as well can cause heavy bleeding, and it can also result in you losing your baby, especially if it's not attended to. So it's very, very important as well. If you see this kind of bleeding, make sure that you contact your healthcare provider immediately. It's very dangerous for you and your baby. And then another thing that can cause heavy bleeding in later stages of pregnancy, vasa previa. This is when some of the blood vessels that are on your baby's placenta are hanging over your cervix. And then when like your membranes rupture, those veins and blood vessels, they can also rupture and then cause like heavy bleeding and then compromising the blood flow to your baby, and very, very dangerous as well. And another thing that can also cause like heavy bleeding is uterine rupture. So uterine rupture, it's like a life-threatening thing that can happen if you have a rupture in your uterus along the scar of your cesarean section. Let's say you're someone who's had a baby before you were pregnant, you had a cesarean section in your first pregnancy, and then now as your current pregnancy now is growing, then that area where they made the cut in your previous cesarean section in your uterus, it becomes weak and then it just ruptures and opens. Now that can cause heavy bleeding, and it's like life threatening. It's a huge emergency that can also cause like so much bleeding. So another thing that can cause like bleeding in later on in pregnancy is one of the things that we know that's very common, especially when you're closer to giving birth. It's when you start having your blood-stained mucousy and sticky discharge, which is called your show. So now the show, it can come anything 2 weeks before you give birth, a week before you give birth, or a few days before you give birth. So a show is that discharge that's closing your cervix, preventing any bacteria or anything that's harmful to your baby from moving from your vagina up to your womb. So when you're closer to giving birth, and as your cervix softens up so that it can dilate, that mucus plug, which is called the show, usually it comes off. So you might see it can be clear, sticky, and it might have some blood in it. So that one usually comes when you're closer to giving birth. If it comes early on in your pregnancy, maybe before you reach term, which is less than 37 weeks, then it might signal that you might be having preterm birth, or you might have preterm birth. So that's also very good to look out for, because it usually comes out when you're closer to getting into labor. If it comes out early, it might signal that you might get into preterm labor. So very important to also look out and contact your healthcare provider if you see it. So basically, there's quite a few things that can cause bleeding in pregnancy. Some of them, they cause light spotting or light bleeding, and they might just like go away. Things like your implantation bleeds, subchorionic hematomas, they might go away. Or maybe you might be bleeding because of a vaginal infection, and then once it gets treated, it goes away. And then there are other more dangerous causes of bleeding, like your placental abruptures, your uterine ruptures, ectopic pregnancies, miscarriage, placenta previa. Those are some of the things now that they are very dangerous. They don't go away, and they do not resolve on their own. So all of these things, it's always better to be on the lookout for them, and whether it is a serious cause or something that will resolve on its own, if you see any bleeding in pregnancy, contact your healthcare provider so that anything that's causing the bleeding can be monitored. So yeah, guys, bleeding in pregnancy is something that's very, very important and can cause a lot of anxiety to women. But some of these things, especially if they are found early and they are managed early, you can still have a proper pregnancy. Or if it's emergencies like placental abruptures, uterine rupture, placenta previa, those things put your life and your baby's life in danger, and you might need emergency care, like an emergency cesarean section. So it's very, very important, guys. Don't sit with bleeding at home if you are pregnant. Make sure you do something about it. Make sure you let your healthcare provider know about it so that something can be done and it can be managed, and you don't have to lose your pregnancy because of that. So that's all I wanted to talk about today, and I hope you guys have learned something from this video. And if you did, please, as usual, please give this video a thumbs up. Please subscribe to my channel and click on the notification bell so that you're always notified when I post a video. And also, if you are comfortable, please do share whatever that you can share that's related to bleeding in pregnancy. And yeah, if you enjoyed this video, you can always just leave a comment just to say thank you, Nurse Lalies. Yeah, so yeah, I hope you guys really learned a lot from this video, and thank you so much for watching. I will see you guys in my next video. Until next time, bye.